Still on health, 813 people have died so far in the latest meningitis outbreak in Nigeria. The Minister of Health confirmed this figure to journalists in Abuja after the Federal Executive Council meeting. Now, experts say the high death toll could have been reduced by adequate vaccination. In April this year, the Director General for the Center for Disease Control, Mr. Chikwe Ihekwazu, at a meeting with the Senate Committee on Primary Health, lamented that his organization has been dealing with the problem of insufficient funds as the agency's 2016 budget was not sufficient to effectively handle the recent outbreak of meningitis in the country. He also asked the National Assembly to intervene in the area of providing access to vaccination for meningitis. Now, another group met with the same Senate committee during the week, also asking the National Assembly and the Executive to urgently give more priority to vaccination and immunization to prevent avoidable deaths in the country.
Do you know that Nigeria has the highest number of children who have not been immunized in the world? This bad news was disclosed by the Chief Executive Officer of the Global Alliance for Vaccine and Immunization, Dr. Seth Berkley, who delivered this shocker at a meeting with the Senate Committee on Primary Health Care and Communicable Diseases. Dr. Berkley says his organization is worried about the immunization system in Nigeria, as records show lower coverage rates of children immunized, particularly in the northern part of the country. He wants the federal government to improve on vaccination of children to reduce the spread of polio, measles, smallpox and other diseases.
I must say, if I have to be honest, that we're quite concerned about the immunization system in Nigeria. The estimates, when I came last year and had an opportunity to meet with the president, they were very high estimates of what coverage was, but these didn't really look right compared to the disease outbreaks. And as surveys have been done, which go out and look at the actual children being immunized, the numbers are much lower. In fact, the current WHO and UNICEF estimates put the coverage as measured by DPT-3 containing vaccine as around 56%. A recent mixed survey actually puts the coverage as even lower than that.
Also at the meeting, the representative of the World Health Organization, Dr. Oko Bele, revealed that there are up to 24 vaccines for children and adults to tackle diseases such as Ebola and cancer. He even said that the vaccine for malaria is being tested in Ghana.
These 24 vaccines should be adopted by countries according to the diseases that are most prevalent. And I would like to indicate that the countries like Ghana in Africa are among those where many of these vaccines have been introduced. Close to 12 or 13 of those have been introduced and are being used. And that country, Ghana and a few others, are already providing us with the opportunity to demonstrate the effectiveness of some of the newer vaccines, including one of the vaccines against malaria.
It was the turn of the chairman of the Senate Committee on Primary Health Care, Senator Mao Ohwabunwa, to respond. And he says the Senate is working with the National Primary Health Care Development Agency in the area of advocacy to increase awareness on the importance of vaccination.
We are aware that Nigeria is expected to provide a counterpart funding of about $11 million, which is approximately 3 billion naira for the 2017-2018 planned measles campaign, like you have just said. Unfortunately, the present 2017 budget could not provide that, but we know that there is a process for supplementary ongoing, and that is one area we want to address. But that, apart from that, we've also taken note that in 2018, definitely we must take this seriously to ensure that adequate fund is provided both for the counterpart funding and for measles and other preventable disease campaign programs.
Violence erupted in Sadwana local government area of Taraba State a few days ago. Now, the casualty figure has not been verified for now by any authority, but we learned that several people were killed in the attack. The Fulani community who was affected in the attack is accusing the Mambila tribe of carrying out this attack. The community in the press statement is asking acting President Professor Yemi Oshibajo to intervene and ensure the safety of the Fulani people in the community. We had an interview with a federal lawmaker representing Taraba Central, Senator Yusuf Abubakar, to find out what led to the attack and possible actions to prevent a recurrence.
The immediate one started, is it on Saturday or Friday thereabout, where there was a meeting and the security agents went there to apprehend the major culprits. They actually arrested some, and they came to, they brought them to Jalingo. So, but the people who are giving different impression that the people were actually, kidnapped. So there was this, where are our leaders, where are our leaders, where are our leaders? So that's what is the immediate cause of the whole crisis.
We've been having issues about herdsmen and farmers' attacks for more than a year now, and this problem has been persistent. What exactly is the issue?
Well, like I said, the issue is about land ownership and land control, and also about, political control of the affairs of the place. The Mambila ethnic group, want to have, they think that, the land belongs to them, so it's their own birthright to have that land, and so they want to control it. So, and you see, much earlier, since the time of northern Nigeria, there was this either policy or law that says, grazing should be on the higher altitudes, farming should be on the valleys. So that's how, it's been distributed over time. But like I said, it is also manipulation.
Are you satisfied with the way which the federal government is handling this problem?
In my opinion, I think, government has to do a lot of proaction in these things. And then both the federal and the state government, the difficulty now and the challenge is that who controls the land? It is the state. The law says the state government will have the land, will have the control of the land. So, and what will federal government do other than, just to sit down and look at the best way to manage this crisis, to separate, the farmers from the herdsmen as they move along before long-term solution of ranching will come into play.